Our next two presenters are from Sunnybrook Medical Center, and they are nurses there. They're going to give you some information on how to manage the side effects. So would you please welcome to the stage now Nesan Bandali and Sirine Khatib. Did I get it right? Okay.
Thank you so much for asking Sirine and I to give this talk on managing side effects of your treatments. It's nice to see some familiar faces. I'm just kind of looking out. Survival for patients with kidney cancer. Is this what I pressed to go front? Okay. Survival for patients with kidney cancer is slowly improving as a result of recently approved therapies that have proved effective in controlling systemic disease, as well as advances in surgical interventions and radiation therapy. And you've heard a lot about this today. For the majority of patients, renal cell cancer is a disease requiring chronic therapy associated with often cumulative side effects. It's most important to manage and adjust treatment as needed, and Dr. Bjornsson talked about that this morning, and to be able to keep you on therapy for as long as possible. With the emergence of these new therapies, it is increasingly important for you to understand the side effect profile of these drugs that you're taking and how to work with your healthcare team to help manage and minimize these side effects. Today we'll be talking about effective patient education, early intervention for side effects, and adhering to your treatment program. These strategies can help optimize clinical outcomes and quality of life for you. Renal cell cancer is, gotta go to the next slide. Renal cell cancer is a complex illness that requires demanding treatment. Patients often face with difficult journey that they did not choose, and a spectrum of physical and emotional hurdles on the road of recovery and optimal quality of life. I always stress to my patients that there are no bad questions. Any questions that you have is a learning experience to better help you in your journey. Educating yourself is very important prior to initiating therapy. Your oncology team has a lot of expertise. Kidney Cancer Canada has written handouts in clinics in your oncology center, as well as valuable information on your website. Cancer Care Ontario also has a website, and you can get a lot of drug information there as well. Trust your healthcare team to take care of you the best way possible and to be able to keep you on treatment for as long as possible. Your nurse is in the front line caring for you. We want to help clear the obstacles and meet the challenges posed by your treatment. Prior to starting therapy, what patients can do is have a thorough dental exam, have a pedicure and manicure, treat yourself, take off all the dead skin layers in your hands and feet so that you're able to go into therapy, because that will get worse. If your feet are not managed, your hands are not managed, then that can get worse, especially with medications like Sutent. Put together a self-care kit. Sports drinks like Gatorade. I had a patient who bought a whole case of Gatorade and actually used it. Water, aloe or lip balm, creams for your hands and feet, mild soap products, body creams, fragrance-free shower gel, ultra-soft toothbrushes, because when sometimes your gums get really tender, it's a really good tool to use with at the same time trying to clean your mouth. Baby toothpaste is another thing that's really, really good. Have a close relationship with your nurse and regular dialogue in order to manage the side effects before they become worse. Keep a book or a journal that's organized with your handouts for common side effects, as well as your symptoms that you're experiencing. No one knows you but yourself. Date your diary so that when you're calling the nurse and coming for a clinic visit, your nurse and doctor are aware of what your side effects are and how they've started and how long they've gone on. Grade them. I often ask my patients, and with clinical trials, you usually are really on top of the grading of the side effects, and I often ask my patients 1 to 10, the 1 being the best and 10 being the worst kind of side effects you can have. Record how you're managing with these side effects. Bring these to your appointments, because if they're at home, I can't see them. This will impact on how your oncologist changes your treatment plan. Today we're going to talk about the most common class of drugs that are currently being used for renal cell cancer. the vascular endothelial growth factors, or TKI inhibitors, and the mTOR, the mammalian target of rapamycin. Both of these classes of drugs inhibit the vascular pathway and interfere with the blood vessel development and tumor's ability to get nutrition. Both of these drugs are oral. Targeted therapies are meant to stop these pathways and cause cell death. In the ideal world, these would only target cancer cells. However, this is not how systemic treatment works. The treatment is absorbed throughout your body. It's often difficult to find targets that are present only in cancer cells. The next best target for these therapies is to hit the cancer cells more compared to the normal cells. The goal of the cancer cell, the goal is for the cancer cells to be killed more often. In a few moments, we'll go into the side effects of these drugs and how they manifest. As you can see from the slide, the first 4 columns, sutent, pasapanib, axanitinib, and sorafenib, have basically the same type of side effect profiles. Fatigue, hand and foot syndrome, hypertension, diarrhea and stomatitis go throughout the spectrum of mTORs and VEGF inhibitors. And then with the mTORs, you're looking more at pneumonitis, inflammation of the lung tissue, infections, hypersensitivity, and both sutent and the mTOR drugs actually do cause at times the blood counts to go down. So you're looking at decrease in your white blood cell count, hemoglobin, and platelets, and your doctor will follow this quite closely. It's very important to be aware of the early signs of these class-type adverse events. Side effects from targeted medications can be debilitating and very common to mostly everyone who's receiving this treatment. The key is to try to mitigate some of these side effects and have a better quality of life so that we can keep you again on treatment longer. In the rest of the slides, Sirine and I will go over the particular side effects that I just mentioned and how you and your healthcare team can help deal with these. I'll first start with the gastrointestinal discomfort. Not a very pretty topic. Symptoms are heartburn, belching, flatulence, bloating, difficulty swallowing. Strategies to help you. Sometimes we ask patients if it's a very mild heartburn, to use antacids. Tums or Gaviscon is something that I know that we do recommend. Keep the whole of the bed up slightly, about 20 to 30 degrees. It's not when you're sleeping. It's not enough to put a pillow under your bed. As you can see from the bottom slide, you can either put blocks at the head of the bed, or you can buy a wedge. Now, I can tell you, I'm sure if you're married, your spouse will thank you if you just buy a wedge. And if you and you can actually buy them at the home health shoppers, and I actually saw one on eBay and Amazon the other day, so it's quite valuable. Another very common side effect of TKIs, and I'm sure if any of you have been on sutent or any of these drugs, you've experienced some of these, is diarrhea. What can you do to help minimize these side effects? Increase your fluid intake, 6 to 8 glasses a day. We often suggest Gatorade or Powerade or some type of sports drinks. If you're not able to have that whole or just straight, then cut it with some water so you're getting fluids as well as some electrolytes. The same premise as if a baby had diarrhea. You give them Pedialyte, and that replenishes some of the electrolytes that are lost in having diarrhea. Consider a brat diet, which is rice, banana, applesauce, and toast. And what this does is that it increases the consistency of your stool. Probiotics is something that also helps, yogurt or high-cultured foods. Metamucil is another good bulking agent. The product will tell you to take it with a whole glass of water, but what you want to do is take it with very little water, because the water that's in your gut that's causing the diarrhea is what you want to absorb. And so take it with very little water so that can bulk up the stool and decrease some of the diarrhea. Keep notes of when and how much diarrhea you're experiencing, and keep in mind the foods that you trigger this. It goes back to the diary that I was talking to you about. Keep notes of what you are experiencing so that you can bring it to your doctor and be able to have a dialogue about that. Keep notes, no, sorry, I just said that. At the same time, your doctor may prescribe Imodium. Oftentimes, I know that Dr. Bjornson will tell patients, first bout of diarrhea, take 2 Imodiums, and then thereafter one, after each one. Or I've got some patients that take Imodium 30 minutes prior to every meal, and this seems to help them as well. And if the diarrhea it's even worse than that, then Lomotil and cholestyramine are other drugs that we also use. Mucositis. This is common to both TKI and mTOR drugs. Mucositis is in the gastrointestinal tract occurs when cancer treatments break down a rapidly divided lining in your gut, and they cause ulcerations and infections. It's important to treat this prior to symptoms becoming worse. So as you can see from this slide, you're looking at, oftentimes we look at grade 1 to grade 4. Grade 1 being, just red, sort of maybe one canker sore. Grade 4, you're not able to talk, you're not able to swallow. That's the worst. The other thing with mucositis is that, and diarrhea, sometimes the skin in the anal area will break down, and that's usually to do with the acid in the diarrhea as well. Strategies that you can use to help with mucositis. Use an infant toothbrush, extra soft toothbrush gently after each meal and at bedtime. Now, the first, the picture with the Biotine and the ultra soft toothbrush, we actually sell them at Sunnybrook as well, and that's very, very good for you to use, especially when your mouth is inflamed and not feeling very well. If you have dentures, remove them throughout the day and at night and clean them every day, so you're taking out the debris. Any type of non-alcoholic mouthwash will also work. We often also tell patients to swish and spit with the salt and water solution or baking soda. And the recipe is right there. You dissolve 1 teaspoon of salt with 8 ounces of water or baking soda, and that neutralizes the acidity in your mouth. And if you don't want to do this, buy club soda. Keep it beside the sink and let it go flat, and you can use that as a swish and spit as well. One of my patients, the canker cover, the oral canker sore patch, one of my patients had just 1 or 2 small sores in their mouths, and it was difficulty to eat. And so what he did was he went around every Shoppers Drug Mart, every place that he could to find some strategies that would help him. And the canker covers really helped him. So what you do is you put a drop in your hand, put it on the area that's hurting, and it lasts up to 6 to 8 hours. And so that's another good strategy to use so that you're able to eat throughout the day. Okay. Eat foods that require very little chewing and are creamy, such as yogurt, puddings, and ice cream, so that they're not hard and they don't hurt your mouth. For anal mucositis, what we suggest is sitz baths. And that helps a lot, or you just sit in the tub with some warm water. Cleanse the area with warm water or use baby wipes. Baby products are really good for this. The zinc oxide extra strength actually helps, as well as skin barriers. And if you're using baby wipes, you're just patting dry that area or patting that area so that it doesn't hurt. Concurrently, your doctor may also prescribe Orabase corticosteroid ointment. We at Sunnybrook use Sunnybrook mouthwash, and that's a mouthwash that actually has lidocaine and Benadryl, and that helps soothe your mouth as well. And if you have oral thrush, then we also have nystatin as well that we can prescribe. That is my talk, and I'm going to hand it over to Sirine to finish it off. Thank you.
Thank you, Nesan. I'm going to start by talking about hand and foot. Oh, how do I go back? Hand and foot skin reactions. These can vary from mild, moderate to severe, as you can see here in these pictures. Mild to moderate can include redness, swelling, tingling, and burning, and sometimes numbness and tenderness in the hands and feet. The severe reactions can include cracked, flaking, and peeling skin, blisters, ulcers, and sores, as you can see here in the third picture, which would definitely cause difficulty walking and using your hands and fingers, which would cause which would impact your quality of life. 5 minutes. Okay, so I'll try to go really fast. And some of the products that we use is Bag Balm, Aveeno, Lanolin. We also tell you to have a manicure and pedicure done prior to the start of therapy, just to get rid of all the calluses so that so you don't develop all of these ulcers. I'll go through hypertension because I think that's an important one, and we might have to skip a lot if there's 5 minutes. Hypertension is one of the most important side effects that requires ongoing and precise communication with your nurse and doctor. It's ideal and recommended. We recommend in our clinic that you buy a really good blood pressure cuff, and you should keep a log of your blood pressure throughout your treatment when you're off and on therapy. Bring it to the clinic to discuss with your nurse and your doctor. We don't know how to treat you if you leave it at home. And what we're looking for is a trend, really. 1 or 2 high blood pressures isn't an issue, but when we see the blood pressure continuing to increase, then we would want to manage it with antihypertensives. We are looking for your systolic blood pressure to be equal to or less than 150, and your diastolic, which is the bottom number, to be equal to or less than 90. And communication is key with your nurse and your doctor. Your doctor may decide to hold your therapy until we have your blood pressure under control. Fatigue. Fatigue is probably one of the most common side effects. You're usually already fatigued from the disease process. Then you add these targeted therapies that can make you immunosuppressed, which would exacerbate the problem, obviously. Symptoms can include exhaustion, feeling of complete worn out, inability to concentrate, and having what patients have described as a heavy feeling. And how can you manage it? We encourage you to continue with daily activities and your daily exercise. And I know that's very easier said than done from our point of view, but it is really important to, if you were exercising before, continue with it. If you were working and you're still able to go to work, to continue to do so. You can also be provided with these disability placards that can help with your daily activities. You can get those by discussing your fatigue with your doctor and having them arrange for you to get them. Your doctor may also keep an eye on your thyroid, and these therapies can alter your thyroid hormone, so we would want to keep an eye on that. And if, in fact, you do need medications for it, we can offer it as well. How am I doing on time? Okay, pneumonitis. Pneumonitis is usually a side effect that develops from the mTORs, which is the medications that end with limus, like everolimus. It usually presents with shortness of breath and a dry cough. We have a case here. This is a patient that we actually saw in our clinic. He had metastatic renal cell cancer, mets to the lungs. He was started on everolimus at 10 milligrams a day. After his 6th cycle, he started to develop a cough with moderate symptoms that impacted his daily life. He came into the clinic, a chest x-ray and a subsequent CT scan was done, and pneumonitis was identified. We decided to stop his therapy for 2 weeks, start him on prednisone. We started 40 milligrams for the first week, 20 milligrams for the following week. We did a CT scan after the steroids, and we noticed that the pneumonitis had resolved. He was able to go back on everolimus. We decreased the dose to 5 milligrams daily, and he was actually able to stay on that for over a year with no problems and no complications. Skin rash is something that can also happen. You can get redness of the skin, rash, itching. The one thing we could get them all together or just one. So wearing a hat, sunscreen, try to avoid the sun, which isn't very hard now with the weather. But when spring and summer do come, wear a hat, sunscreen. Also, one of our patients actually noticed that when she used Head & Shoulders shampoo as a body wash, it relieved some of the itching and rash. So she tried it, she liked it, and I think we have a patient here also that used it after getting an irritation on their scalp, and that helped significantly. Your loss of appetite. That happens obviously from the disease process as well as from the therapies that we offer. We recommend in our clinic to have small meals, maybe 5 to 6 small meals throughout the day instead of 3 large ones. We tell you, when you're eating, eat high-calorie foods. Anything you've been avoiding your whole life because it was fattening, eat it now. Protein shakes, the essentials breakfast, the carnaceous essentials apparently is much better tasting than the Ensure and the Boost we hear, so a lot of our patients do use that. And adding gravies and broths to food also can help. And this can also, the therapies can also change your taste. A lot of patients say that they develop a bitter metallic taste to food, so we suggest they use plastic utensils. Try to avoid canned foods, canned fruit and vegetables, and don't use mint-flavored toothpaste. Try to have lukewarm food, not too hot, not too cold, and smoking, obviously. Okay, so the take-home notes. Oral therapies for renal cell are individualized for dose and schedule to every patient based on drug side effects and patient tolerance. It is important to note that staying on the therapy with significant side effects for prolonged periods of time may result in patients being off treatment for too long, thereby affecting the positive effects of this therapy. So communication with your nurse and your doctor is key. If we can stop these side effects from becoming severe, we can keep you on therapy for a longer period of time. Our ultimate goal of treatment is to have the patient on therapy for as long as possible by controlling side effects and individualized therapy schedules. Thank you.